Hi everyone, I'm Ciara, a CBT therapist from Keeping Well Northwest London, and we are a staff support service for all NHS and health and social care staff operating across the Northwest London region. We know with the COVID-19 pandemic that there's been a huge focus on rolling out the vaccines for both coronavirus and also for flu amongst healthcare staff. And naturally for us staff members with a phobia of needles or injections, these discussions can be really anxiety provoking and we mightn't feel comfortable talking to our managers or talking to our colleagues about our fears. Incidentally as well, we might be a little bit unsure of how to get support for this phobia. So we thought it'd be really helpful to make a video to answer some of your questions around this. Colleagues, what I can tell you is that a lot of people out there do have needle phobia. It's actually estimated that up to 10% of people across the world have a phobia or a significant fear of needles. So straight away, that tells us that it's a lot more common than what we think. It can be very hard and isolating for us when we do have a needle phobia. We can often feel really embarrassed or very silly for having this phobia. And we can often feel as well that people won't really understand what we're going through. We'll usually do anything within our power to try and avoid getting injections or hearing conversations about vaccines, etc. Because for us, these things can be really anxiety provoking and really upsetting. We might as well just feel that our phobia can't be cured and it's essentially something that we're just going to have to live with for the rest of our lives. So this is where I do bring in the good news for you. What I can tell you is that we can treat needle phobia using a psychological therapy called cognitive behavioural therapy, which is otherwise known as CBT. CBT is a very goals-focused therapy, and we've actually developed a specific treatment within it called applied tension with exposure. Now, the nice thing as well about this therapy is it has a really high success rate. Exposure programs for phobia have been shown to be as high as 85% effective. So we know that the success rate is really, really positive. Another pro as well of this treatment is that it's not a long-term therapy. It can be easily treated within just a few sessions. And with CBT, it's a very collaborative therapy. So the therapist will never decide what you should be doing. If anything, the therapy is collaborative between the therapist and the patient. Before I talk to you a little bit more about this treatment, I think it's really important that I talk to you about what generally happens for people when they have a very general phobia. Now, when I'm talking about a general phobia, I'm talking about things like a dog phobia, a spider phobia, a phobia of crowded places, etc. What usually happens is when people have these phobias, and encounter these things, they can get this huge burst of anxiety and the fight or flight response will kick in. So that essentially means that they'll have a lot of adrenaline coursing through their body, and their body, as a result, will respond to this adrenaline. When we have those kind of general phobias, we might notice that we'll start to shake, our heart will start to race, we'll feel really sweaty, and our blood pressure goes up. Now, I want you just to hold that in your mind, that with general phobias, the blood pressure goes up. And the blood pressure could go up so high that people with general phobias can actually have panic attacks. So keep that in mind. There's a reason why I'm going to explain why. When people have a needle phobia, there's a very unique response. Yes, they will get that burst of anxiety when they do encounter injections or needles, but what actually happens is that the blood pressure drops. So it actually goes down. It's the opposite of what happens with general phobias. And the blood pressure can drop so much that you can actually faint. So keep that in mind. We obviously want to take this into account in treatment. We don't want people fainting or hurting themselves in any way. And we want to make sure that you're safe during the treatment. So what we then do is teach you some practical exercises to try and stop yourself from fainting. These exercises are known as applied tension. And essentially, we train you to tense and flex your muscles repeatedly to get that blood pressure up. So that way, when you get the blood pressure up, you'll be able to cope in situations when you start feeling faint due to the phobia being triggered. The more you practice these exercises, the more confident you'll be in coping with these situations. And these exercises can be taught to you by a CBT therapist. Once you feel comfortable and you feel that you've mastered these exercises, your CBT therapist will very, very slowly start to bring in some triggers which may remind you of the phobia. This is going to be different for everyone. For some people, it might include watching a segment of Grey's Anatomy, or for others, it might include listening to a story at length about someone having their COVID-19 vaccination, or for other people, it might include watching a video on someone getting vaccinated. That's something that you can have a conversation about with your therapist. However, what's really key is that when the therapist brings in those triggers in a very gentle way, you are also to do the applied tension exercises to make sure that you don't faint. Because again, we want to keep you as safe as possible. So you're probably thinking at this point, Ciara, this all sounds great. What's the treatment? Okay, I'll tell you about the treatment and where to find that support. You can make referral to an NHS IAPT service. Every borough of London has an NHS IAPT service, and IAPT services operate all across England. You can self-refer, or your GP can make that referral. The other option is that you can refer to us at Keeping Well, Northwest London, and we can actually make the referral to the IAPT services or service on your behalf. Colleagues, if you have any questions or worries or any concerns about anything covered within the content of this video, please don't hesitate to drop us a line at Keeping Well. The details will flash up on the screen at the end of this video. Equally, if you'd like to get some treatment sessions organised, you can get in touch with us as well. Please remember that you're not alone. You've taken the first step already in reaching out for support just by watching this video. And best of luck, and thank you very much for watching this.